Welcome to Clinical Minute. Lolani is an 18-year-old Gravida 1 Para-Zero college student who presents for follow-up 1 week after a first trimester aspiration abortion. She is healthy and takes no medications. She is heterosexual with 3 previous male partners and has a new partner for the past month. Prior to the pregnancy, she used combined oral contraceptives, or COCs. When asked, Lolani tells you that she would typically miss 2 to 3 pills each month. You ask, "What are your thoughts about contraceptives?" And Lolani says, "I need to continue the pill because it's the only thing that clears up my skin. Besides, I've learned my lesson, and I will make sure to take it every day." How do you respond to Lolani? You engage in active listening to understand her goals and preferences. You ask, "What is most important to you in a contraceptive? How important is preventing pregnancy?" Then you pause to listen to her response. She says, "Treating my acne and not getting pregnant." You ask for clarification, saying, "What is the #1 absolute most important goal for you?" Lolani pauses and then says, "Treating the acne is important, but the absolute most important thing is that I not get pregnant again. I mean, until I'm much older and want to be pregnant." You say, "What I'm hearing you say is that the most important aspect about a contraceptive for you right now is that you don't get pregnant again until you decide you want to be pregnant. Is that right?" Lolani replies, "Yes, that's right." What do you do next? You use the TierBased Counselling model. TierBased counseling is based on presenting contraceptive options by groups based on effectiveness. Recommended by the Centers for Disease Control and Prevention and the World Health Organization, TierBased counseling provides a simple visual way to compare the effectiveness of contraceptive methods. It helps patients put side effects and other features into a perspective that incorporates effectiveness. However, if not used with care, this counseling method can be too directive and even coercive because it assumes that avoiding pregnancy is the most important priority for the patient. Although effectiveness is the most important attribute for most women, other factors may be more important for specific women, which is why it's important to clarify each woman's preferences and goals for contraception. Other features that may be important to some women include whether the method can be used covertly, side effects such as changes to menses, and anticipated time to return to fertility, and the ability to control starting and stopping the method. Here are some tips to ensure that you are respecting autonomy in decision-making while using TierBased counseling. Use this method in the context of counseling that includes conversation about the woman's reproductive needs and desires, and about the benefits, risks, and side effects of all options. If a woman indicates that effectiveness is most important, say, "It sounds like avoiding pregnancy is the most important thing to you. I have a chart here that shows the most effective methods of birth control," and show her the visual aid. Do not assume that a woman should choose a method from the most effective tier, which includes long-acting reversible contraception, or LARC. In other words, do not push LARC. Research has shown that when women are fully informed about the effectiveness and other features of contraceptive methods, and when LARC methods are available and affordable, most women choose LARC methods. This slide shows a TierBased counseling visual aid, adapted from materials developed by the World Health Organization. It provides a visual comparison of the typical effectiveness of contraceptive methods. IUDs, implants, and sterilization are considered top-tier methods because less than 1 pregnancy per 100 women occurs in a year with the use of these methods. These methods are more effective in preventing pregnancy than the second-tier methods, not due to their mechanisms of action, but because they are easier to use properly. Once the top-tier methods are initiated, they require little additional action to provide highly effective contraception. You show Lolani the visual aid. You explain that the chart shows the typical failure rates and that the top-tier methods have a lower risk of pregnancy. You show her that the typical failure rate is much lower for the top-tier methods, which include sterilization, IUDs, and the contraceptive implant, compared with other methods, including the pill. Lolani says, "Wait a second. I remember the pill having a high rate, like 95% or something. What do you say?" When counseling about the effectiveness of contraceptives, it is important to share the typical failure rates and not just the perfect failure rates. Perfect use is when the method is used correctly and consistently as directed, whereas typical use is how the method is actually used, thus including inconsistent and incorrect use. You explain to Lolani the difference between typical and perfect use rates. You explain that with typical use, the failure rate of combined oral contraceptives, or the pill, is 20 times higher than that of the IUDs and implant. You tell her that there are many reasons why the typical use failure rate is higher for COCs, as well as the patch and the vaginal ring, than for the top-tier methods. Some of these reasons include forgetting, running out, gastrointestinal illness, and not having the method available. For example, being away from home overnight and not having the pill with you the next morning. Lolani says, "Yes, that's what kept happening to me. I'd stay overnight with someone and forget to take the pill when I got back home the next day." You review the basic attributes, benefits, and side effects of the various methods. You then provide an implant, a vaginal ring, and an IUD for Lolani to touch. She says, "They are all much smaller than I thought." What do you say next? You ask Lolani which method seems best for her. You let her know that if she decides to discontinue the pill and her acne returns, other treatments are available. You show her a paling palette with the different types of options as another way to show effectiveness. She looks it over and says she doesn't want an IUD up there, but would like to have an implant inserted. She says it would be a relief not to need to remember to take a pill every day. You review the risks, benefits, and potential side effects of the implant, including the effects on the menstrual cycle. You also emphasize the need for STI prevention with consistent use of condoms and the need for 7 days of backup contraception. How do you ensure that Lolani has understood the information you've provided during contraceptive counseling? You use the teach-back method to assure that Lolani understands the information presented. You ask Lolani to tell you in her own words what she understands about the information you just shared. She is able to repeat back the key points that you described about the implant. You tell Lolani that you can offer same-day insertion, which Lolani tells you she would like. You offer Lolani a follow-up appointment to check on her acne and how the implant is working for her. Your support staff brings the needed supplies, and you complete the insertion in a few minutes. She leaves the office saying, "I've got to tell my friends about this. No pill to remember, and no worries about getting pregnant."